So we're starting this morning with a keynote address from Jason Lagria, Acting Director at the Office of Disability Integration and Coordination at FEMA. Jason most recently served as an attorney advisor within the FEMA Office of Chief Counsel, where he was embedded counsel for ODIC and the Office of Equal Rights. He also served as acting deputy director for the Office of Equal Rights. Since joining FEMA in 2019, Jason has provided critical counsel to advance and ensure equity and civil rights across FEMA's programs. He was awarded the 2020 Secretary's Award for Diversity Management for providing legal advice to uphold civil rights and civil liberties in FEMA's COVID-19 response efforts. Jason graduated from George Washington University Law School and Johns Hopkins University. He was raised in Houston, Texas, but currently lives in Maryland with his wife and 2 daughters. Jason, we're looking forward to your remarks. The time is now yours.
Thank you so much, Vance. I really appreciate the introduction and having me here today. Before I go on, I would like to describe myself. I'm Filipino American with brown skin and black hair, and I have a blue shirt on and I'm wearing a headset so folks can hear me clearly. And my preferred pronouns are he and him. So again, thanks to Vance, and special thanks to you and your appointed Governor's Office of Emergency Services, as well as the International Association of Emergency Managers, the Colorado Division of Homeland Security and Emergency Management, and NYU, as well as our sponsors, the American Red Cross and Big City Emergency Managers, for convening the first National Access and Functional Needs Symposium. Also, I attended yesterday's sessions and they were excellent. And I really appreciate the discussions that were had. And thanks to all the speakers yesterday and today. It's really an honor to speak, and I hope this becomes an annual event for us to collaborate and coordinate on our shared commitment of helping people with disabilities before, during, and after disasters. I'm here today to represent FEMA and the work of the Office of Disability Integration and Coordination does to meet our agency's commitment to equity and inclusion for people with disabilities. I'm honored and humbled to do so because it's a mission that I strongly believe in. So just a little bit about myself. I have a close and personal connection to the impact of disability on my family. When I was in college and law school, my father experienced a series of strokes that left him with physical and mental disabilities, and he needs assistance with daily living activities. So because of this and the work that FEMA does and all of you to ensure the needs of people with disabilities and their families are taken into account, preparing for, responding to, and recovering from disaster, it's something that means a lot to me, both personally and professionally. And I'm also the son of Filipino immigrants. I've seen firsthand the challenges that immigrants face accessing government programs and services. In Filipino, we have a word called bayanihan, which means a spirit of community unity and support. And I was brought up in this spirit of always helping my large extended family, friends, and neighbors. And this is partly why I pursued a career in civil rights, including advancing the rights of people with disabilities. And I found it to be a very fulfilling and rewarding career path. And this is how I'm here today. FEMA continues to prioritize people with disabilities in all cycles of emergency management and works to ensure people with access and functional needs equally benefit from FEMA programs and services. But we don't do this work in silos. We do it with the collaboration, cooperation, and dedication of our state, local, tribal, and territorial, or SLTT, governments and emergency managers, private sector, nonprofit partners, and community-based organizations. So basically all of you in the audience. Whatever your role in this symposium is, presenter, participant, reporter, advocate, you are here because you share FEMA's commitment to equity for all people, including people with disabilities. The importance of equity in emergency management is not a new concept. Under the Stafford Act, the FEMA assistance must be delivered in an equitable manner without discrimination, including on the grounds of disabilities. That said, I think what is new, or at least renewed, is our nation's focus on a proactive approach to policy, programmatic and purpose-driven equity. Now more than ever, we are dedicated to identifying opportunities and innovations that enable us to meet people where they are in their communities and provide everyone with the same access to programs and services. A community's history, culture, and the unique identities and the needs of its community members all influence its ability to access federal services. Underserved communities face a disproportionate impact from disasters, as we've all known and heard. They experience differences in preparedness and mitigation measures, as well as how quickly their communities can resume social and economic life after a major event. That's why FEMA is applying a greater emphasis on where we are directing our resources and ensuring we are routinely evaluating our programs and policies to ensure equal opportunities to access our programs. We're also targeting our efforts to address observed disparities in the outcomes that I'll talk about. In President Biden's Executive Order 13985 on advancing racial equity and support for underserved communities, agencies were required to evaluate opportunities to increase coordination, communication, and engagement with community-based organizations. FEMA applied this imperative to our new 2022 to 2026 FEMA strategic plan. We increased our engagement with organizations to develop a strategic plan that puts people first. The plan was developed with input from all of our partners, stakeholders, federal, SLTT partners, non-governmental organizations, and the private sector, as well as our employees here at FEMA across the agency. We listened, and the feedback we received contributed to the goals, objectives, and strategies for how we can better support our employees and those we serve. In April 2021, FEMA issued a public request for information, seeking information on how our programs, regulations, and policies could better advance the goals of equity for all, environmental justice, and bolstering resilience to the impacts of climate change. During the comment period, FEMA hosted 2 public meetings to gather additional feedback and maximize public participation. We received hundreds of stakeholder responses focused on the issues of preparedness, climate change, flood risk, mitigation, and recovery. Even as our teams were reviewing the responses, we still added more voices. In winter 2021, we held our 2nd annual Civil Rights Summit, bringing together FEMA leaders with leaders from civil rights organizations. What's more, the dialogue and partnerships from this event fostered will help us to continually improve our efforts. All said, as we developed this plan, we had input from more than 1,000 FEMA employees, 400 external partners, including 50 tribal nations. We released this plan in December 21, and I encourage you to check it out on FEMA.gov if you haven't seen it. An example of a highlight of how FEMA has made its programs more equitable is, and I'm really proud of this one, is FEMA's changes to the individual assistance program policies to advance equity for disaster survivors. That includes expanding the forms of documentation allowed to prove ownership and occupancy for homeowners and renters, which is critical for applicants who lack certain legal documents to prove that they own a piece of property. We now accept forms of documentation such as DMV registration and utility bills. So today, FEMA is leading the way towards more inclusive emergency management, which includes purposefully considering and addressing the needs of people with disabilities before disaster, as well as during responsive recovery. As equity is a central goal of our strategic plan, people with disabilities are helping us develop those solutions. We consider equity and emergency management to be a shared responsibility, not just with our partners, but within every program and team in the FEMA workforce. We are integrating equity as a foundation of our culture through transformational change within our workforce, across our programs, and throughout the emergency management community. Putting people first is the administrator's priority, which is why the first objective under our every goal is about the emergency management workforce. We must invest in our people to make sure we can continue to meet the needs of our communities. Our FEMA team must reflect the communities we work in. Having a diverse team with various experiences only makes us stronger, more attuned to the various needs of the community, and more open to a diversity of thought that could lead to programs and services that are more accessible. I was listening to the discussions yesterday, and one of the speakers talked about trust, and it's really important. I've worked in the Asian immigrant community where there can be distrust, for example, and diversity in all the branches of government is important to address this barrier to accessing government services. Having a team member like me, who's a child of immigrants and has families who are limited English, family members who have limited English proficiency, helps bring that knowledge and institutionalize it here at FEMA. We also have staff with disabilities and years of experience who are also part of FEMA program offices who can add their own experience and expertise based on their experiences. We recognize that FEMA is better able to serve the diverse needs of communities when our leadership and our staff reflect the communities we serve. Diversity is not good, not only for diversity's sake, but because it really makes business sense. So with the strategic plan as our guiding force, we are moving forward, integrating equity across our policies and programs and throughout the emergency management community. We are directing resources, ensuring informed decision-making, and routinely evaluating our programs and policies to help eliminate disparities in access and outcomes. We are also strengthening our strategic partnerships and expanding emergency management inclusivity, competency, and commitment. FEMA's commitment to diversity extends beyond our workforce too. We recognize that building, strengthening, and growing partnerships between federal and state emergency managers and community-based organizations will enable us to fulfill our commitment to equity. And what's more, it will help us all grow together and improve outcomes for people with disabilities. That's why our strategic plan elevates the significance of partners with non-government organizations, including disability, faith-based, and other community organizations. All of this can work together to ensure that people with disabilities have access to programs and services in the communities where they live and work. And here's an example that came up a little bit ago. Based on facilitated discussions with disability stakeholders, FEMA issued guidance on the provision of personal assistance services and mass care sheltering. And we presented this guidance to stakeholders across the country. And that was thanks to, again, working with and reaching out with community-based organizations and stakeholders. This brings me to the reason why I'm presenting here today at the symposium. The FEMA Office of Disability Integration and Coordination, or ODIC, is the cornerstone to our agency's commitment to equity for people with disabilities. ODIC was created to advise FEMA and our SLTT partners on integrating the needs of people with disabilities into the whole spectrum of emergency and disaster preparedness, response, and recovery programs and services, and to provide technical assistance. The establishment of ODIC after Hurricane Katrina affirmed FEMA's commitment to equity for people with disabilities. ODIC works at headquarters, in the regions, and in the field during disasters so that people with disabilities have what they need. Many of you are likely familiar with the work of ODIC, but for those of you who may be new to this space and to add context to our role in FEMA, I'll just give a brief overview. Our headquarters team works across FEMA offices to provide advice and guidance on how to integrate the needs of people with disabilities into FEMA programs and services, which includes working with our individual and public assistant teams, as well as every other program in the agency. A critical part of the headquarters team is to deploy subject matter experts to provide communication and operational guidance during federally declared disasters through the Disability Integration and Coordination Desk at the National Response Coordination Center. We make sure that information is flowing from headquarters through FEMA regional offices and to disaster operations in the field, and also back up to the communication chain. In the 10 FEMA regions, FEMA also has regional disability integration specialists who work with SLTT communities. This work before disaster includes education and outreach, and during active disasters, providing advice and guidance to regional and field leadership on the needs of people with disabilities impacted by a disaster. They also work closely with our disability integration cadre to deploy to active disasters. These are disability integration advisors and disability integration specialists who work with field leadership to make sure the needs of people with disabilities impacted by a disaster are being met. So as you can see, all these team components are structured with the intention of identifying barriers and providing solutions before disasters happen as well. One way we do this is with the support of ODIC experts spearheading data-driven decisions within our National Response Coordination Center that lead to actions by field staff that are aimed at producing better outcomes for people with disabilities. Our teams use several internal and external data sources to help quantify the needs of people with disabilities during preparedness, response, and recovery operations. And the multiple facets of data analysis we use to enable us to execute data-informed decisions for equitable program delivery. These data-based decisions also guide our work within communities and with stakeholders like you to maximize outreach to people with disabilities during an active response. For example, during Hurricane Ida, ODIC tracked FEMA individual assistance registrations in which people are self-identified with disabilities. Using comparative analysis between those registrations and the most recent census data for the impacted areas, we identified parishes where registrations were below expectations to focus our outreach efforts. FEMA individual assistance registrations as a data source are a great example that can tell us a lot about people with disabilities in an impacted area. In 2020, we made improvements to the registration intake question that asked disaster survivors with disabilities to self-identify, and then added waterfall questions where they can provide information about the assistive devices or other materials they lost in a disaster. By changing the way we ask this question, we've seen an increase in people self-identifying with disability from approximately 3% to 15%, which more closely matches the census data we monitor about the population of people with disabilities. This tells us that this question is working better now. It's enabled us to reach more people and will allow for better outcomes for survivors. We evaluate data sources like the census and FEMA's National Risk Index data, as well as data from the Department of Health and Human Services and the Centers for Disease Control Social Vulnerability Index. So we are focusing agency resources where they are needed the most. And we're constantly expanding these capabilities. My team in ODIC is currently in the final stages of expanding a data dashboard that will enable us to compare these data sources with FEMA registration data in real time. This is a great development. We will provide this data to state and regional response coordination teams during this hurricane season, which we have all heard by now is predicted to be another active one. I'm going to switch gears a little bit from internal operations to our work with all of you. As I said earlier, we don't do anything in silos. And what more, we are committed to ensuring our partners never stand alone. One of the primary purposes of the symposium is to make connections that enable us to better work together with you and utilize our combined resources in the most effective way possible at the national, regional, SLTT levels to help people with disabilities before, during, and after disasters. As I mentioned before, our regional disability integration specialists work with partners and community organizations that serve people with disabilities. One great example of this is the partnerships between FEMA disability integration specialists and their respective centers for independent living. Working together to include people living within these centers and exercises helps to identify gaps in how the centers are coordinating with emergency responders and communicating accessibility needs within emergency sheltering. These types of exercises also address knowledge gaps for people with disabilities on what to expect in emergency sheltering. Many of you may have seen this concept in action last month during the Cascadia Subduction Zone exercise, as Center for Independent Living members in Region 10 participated in a tabletop exercise that examined the ability of emergency planning stakeholders to respond to local disasters and catastrophic events. It was a first of its kind event in the state of Washington to engage centers for independent living and people with access and functional needs in emergency management. We received valuable insights from that exercise that are being shared with other FEMA regional disability specialists. What's more, we heard positive feedback from disability organizations about the inclusion of people with disabilities in the exercise. FEMA believes that the disaster response and recovery works most efficiently when it's locally executed, state managed, and federally supported. So while we are affirming our commitment to equity in emergency management, we recognize that states must also commit to equity if we are to improve outcomes for underserved populations. FEMA stands ready to help you. For example, while there are a few states that have an access and functional needs coordinator as part of their emergency management office, who our regional disability specialists engage with, not all states do. For the states that don't have an individual in that role, our disability integration teams try to find the person or people who are working on those issues and engage with them. In some cases, it's the state's ADA coordinator or a public health coordinator. Whatever the state-to-state variables may be, we work with the existing infrastructure to identify the appropriate people to engage with to ensure that together, we're helping people with disabilities in their communities. At the local level, the core of that infrastructure are our state emergency managers. Our disability integration teams work with them on how to meet the needs of people with disabilities before, during, and after disasters. They also serve to connect emergency managers with people with disabilities and the disability organizations in their communities. These organizations are valuable resources and primary lines of communication for people with disabilities in their communities. By connecting them, emergency managers, like many of you here today, can begin to plan together. Emergency managers often recognize the need to include people with disabilities into preparedness efforts, but don't always know where to start and which information to rely on. Our job is to help them increase their knowledge on disability issues and create connections with disability organizations in their communities so they have readily available resources to draw upon. Well, I know we're focusing on access and functional needs here this week. We all know that disability encompasses many things that can affect a person's mobility, communication, comprehension, and coping abilities. So there are a broad range of considerations that need to go into creating planning factors for a community. FEMA helps communities understand how to mitigate hazards and how to respond to and recover from disasters. One of the ways we do this is through internal and external training opportunities. And I'm pleased to announce FEMA is developing a new webinar and technical assistance program that will provide emergency planners and managers throughout the nation with tools and resources necessary to develop and maintain inclusive emergency plans. The program will consist of 2 online webinar sessions, a checklist, and other disability community stakeholder resources. This will allow emergency planners to learn more about specific resources available throughout their jurisdictions. By moving to a web-based platform model, FEMA is no longer constrained to a limited classroom format, and emergency managers are no longer constrained by the expense, travel, and time commitments of an in-person training. We're really excited about this, and we expect to launch the program by the end of this calendar year, and we'll be sure to share more information about it when that's ready. Of course, a FEMA investment in disability, equity, and inclusion training starts with our own workforce too. In addition to the technical assistance and subject matter expertise, ODIC provides trainings to our FEMA teams. We do trainings to all new employees when they join the agency. We are also launching a new course this fall that will guide our disability integration advisors on supporting key leaders in the field and managers at the branch level to increase and access and promote fully inclusive practices for people with disabilities. Our team also offers interactive training courses to all FEMA program offices 24 every day of the year. Last year, the ODIC training team conducted disability, equity, and inclusion training to more than 5,000 employees, including over 1,000 FEMA registration intake staff. Finally, we offer an online self-paced IS 368 training course for all FEMA employees, as well as non-FEMA personnel involved in disaster operation. This course is designed to help participants develop a working knowledge of the principles of disability integration into emergency management operations and explains how disaster staff can apply inclusive practices during response. We've recently redesigned this training, which will be available this December, I believe, to align with our agency's new strategic objectives. So in closing, I'd like to leave with a couple of points that help me put our collective purpose into perspective. First, it's important to remember that the work we all do has an impact, not only on individuals, but to families like yours and mine, friends and communities. In my role as an attorney before I took on this detail, I concentrated on compliance and enforcement, and it's rewarding and necessary, but it's very reactive. I've been in this acting position for a few months now, but in this time, it's been refreshing and eye-opening to see how FEMA is working proactively to address the needs of people with disabilities. Our staff are working throughout the year, not only to meet the requirements for compliance, but to go above and beyond, to find real world solutions, to be creative, to ensure equity in disasters for the disability community. And this brings me into my last point. According to the CCDC, there are approximately 61 million adults in the United States that live with a disability. Disability intersects every demographic. They live in every region, city, municipality. And we all know that disability can impact any of us at any time. What this means is that all of us are part of the disability community. And the work that we do here in collaborative spaces like this symposium will help us be a stronger and more unified and supportive community, much like the spirit of Bayanihan I was brought up with. Your challenges at the SLTT levels are FEMA's challenges to meet and overcome with you. So we are stronger together. So I want to thank you everyone here for your time today, and thank you for participating in this symposium. I really look forward to hearing from the outcome from this event. And again, I hope this happens again in the future. So again, thanks, Vince, and I'll hand it back to you.
All right. Thank you, Jason. Appreciate your remarks very much. Great information.